Do you want your business to grow? Do you want the access to global network? Gain the business and investment opportunities. Build lasting business friendships and strategic partnerships. Become a member of CEO Club's network and prepare your business for an amazing change. CEO Club's network is the most effective business platform for CEOs and decision makers to share experiences, explore opportunities, and grow business connections locally and internationally. What do we do for our members? We organize monthly business events with a strong focus on networking. Get exposures and recognitions as we serve members with a wide range of benefits. Members can take part in industry-specific panel discussions, roundtables, lunch meetings, breakfast meetings, awards nights, gala dinners, and other informal gatherings, like cigar nights or high teas. Through our unique CEO Club's mobile app, we help our members to connect with powerful business figures, community leaders, and government officials in selected countries worldwide. So, if you are looking for a multicultural atmosphere, strong networking platform, and millions of B2B connections, CEO Club's network is the right place for you. Powerful global brand and network for decades. More than 50 awards received globally. The knowledge with experience makes the difference. Join CEO Clubs and be part of the whole new world of prestige and pride. Give us a call or visit our website and get connected with a unique world of business opportunities.
Thank you very much. I'd like to welcome you all in the CEO Club exclusive webinar panel discussion with the topic of global healthcare system innovation and transformation during and after this pandemic. And today we have healthcare experts from 5 different continents: North America, Europe, Africa and Middle East, Asia, and Australia and New Zealand. As we all know, that COVID-19 has disrupted the human life, businesses, economics alike. More than half of the humanity is under lockdown. People are working from home with restricted movements. CEOs from all industries have a major responsibility to ensure the businesses supported through IT in this uncertain times. Without loss of productivity, IT infrastructure, applications, telecom network operate securely, and while most of the employees and customers access their application through the public internet. But the most important things that our support to the healthcare workers who are in the front line. These people are really the heroes in this current situation. We all know that CEOs and business leaders like yourself have a crucial role to play in helping the world getting through this current crisis. Today, we all will hear from our influential leaders in healthcare from 5 different continents on their strategies that drive action and how to lead through the crisis and incorporating in the business innovation and technology. As the COVID-19 continue to spread around the world, designated global emergencies by the World Health Organization, the outbreak has had far-reaching effects on people's health, travel, supply chain, economies globally. With the wonderful world of technology and internet, we have many more ways to communicate with our families, with the world around, like we're doing it today's webinar. Today's webinar is a CEO Club webinar with influential leaders on healthcare, and I'm very proud to have all my panelists here from North America to China, who will be joining us soon. I'd like to introduce the first panelist from North America, from USA, Mr. Randy Ostra. He's the president and CEO of ProMedica, one of the largest healthcare provider in US. We have from Europe, from Netherlands, Mr. Harry Verbund. He's the healthcare leading the Hewlett Packard Enterprises in Netherlands. Then we have from Africa and Middle East, Dr. Raza Siddiqui is a Group CEO of Arabian Healthcare Group in United Arab Emirates. We will have from China, Mr. Simon Go, who is the president of ZAC Medical Company in China, who will be joining us soon, have some technical issues right now. And then lastly, from Australia and New Zealand, representing Mr. Sam Amroy. He's the general manager of MENA region of Orient Health, who is based is a global organization from New Zealand. So I'd like to welcome you all at this special webinar organized by CEO Club. So the way that I like to conduct this webinar, I like to give each one of you to kindly, I appreciate to introduce yourself and talk a little bit about yourself and the company. So our participants from all over the world who are listening to this thing would know more about yourself and the organization that you are with. So I will like to start with from USA, Mr. Randy Ostra, the President and CEO of ProMedica. Kindly say a few words and about in a few minutes about yourself and the company of ProMedica.
Great, and good morning. Yes, ProMedica is a health and well-being company in States. We were probably more kind of traditionally thought of a hospital system, but over the last number of years have changed fairly radically. Today, ProMedica is right around a $7 to $8 billion company. We operate in 28 states. We operate the largest nonprofit senior company in the United States. And in addition to that, kind of our original footprint was more in Ohio and Michigan, where we operate hospitals. We have a large physician group, and we have an insurance company. And really, our focus has been about health and well-being, and a lot of the things that we all think about every day. And increasingly, our focus has been on providing services outside of the hospital. So that includes not only the things we do clinically, but also the things that we think about relative to social determinants of health. We've been very active in addressing the social determinants for over a decade, and then a lot into healthy aging. And so a lot of our focus right now is delivering healthcare services to homes, and the technology exists today to be able to do that. And a lot of our future expansion is around that, trying to be able to, through technology, keep people at home. And really that's kind of the focus of what we're doing today. A lot of interest in longevity, a lot of interest in improvements that need to be made to the U.S. Senior care world. So that's a little bit about our company. I've been there for over 20 years, been over the CEO for over 10. And, again, right now we'll talk about more. It's just been a really interesting time as we exit COVID and we try to get our businesses back going. Personally, I've been married for 40 years, have 3 sons, and all married, and a couple granddaughters. So thanks, and great to be with you this morning.
Thank you very much, Mr. Randy, and I had the pleasure of meeting your wife also. So please give my regards to her. Thank you very much.
Thanks.
And now I'd like to request from Europe, from Netherlands, Mr. Harry Burbank. He's the healthcare lead of Hewlett Packard Enterprises. So please, Mr. Harry.
Yes, good morning, good afternoon, everyone. My name is Harry Verbund, as you already mentioned. I work for Hewlett Packard Enterprise. Well, I don't think I need to introduce it very broad, but Hewlett Packard Enterprise is 80 plus years old. We've seen some changes in the 80 years. I've been with this company for already 25 years, and for the last 12 years, 13 years as healthcare lead from the Netherlands, with also an international perspective. What we do as Hewlett Packard Enterprise, we are, as we say, the edge to cloud infrastructure as a service company. That means that we are focused on good infrastructure, and also that's very important this time, also in the healthcare market. And together with partners, we see that we fulfill the right solutions together with partners like Epic on the EHR system, or Chipsoft, or Philips Healthcare, etc. So that's and that's our main focus, together with partners, to see what we can do to make a stable fundament for healthcare, and that can be cure and care organizations.
I see. All right. Okay. Thank you very much. Now I request from Africa and Middle East region, Dr. Raza Siddiqui. He's a Group CEO of Arabian Healthcare Group in UAE. So Dr. Raza, please.
Hi everyone, this is Dr. Raza Siddiqui from Dubai. It is a pleasure to be with all of you eminent healthcare specialists in different areas. I have been into healthcare for more than 4 decades now. I have been in UAE for the last 22 years. Before that, I was in India. I spent 10 years of my initial career in pharma marketing. From there, I moved to fashion design for 7 years, a strange move. And from there, I came into healthcare management. So for the last 25 years, I have been running hospital healthcare systems. I came to UAE in 1998 when the healthcare system was in infancy and the population was only 2.5 million. From there, we have seen a transition, big time development. The population has grown from 2.5 million to 10 million now. And the healthcare system has moved from government-run subsidized healthcare system to almost fully insurance-supported healthcare system. This is one of the best countries to live now in terms of the healthcare infrastructure available. I think the reach of healthcare is to everyone in this region. I presently run a boutique hospital, which is in Ras Al Khaimah, which is around 120 kilometers from Dubai. I am also on the board of education, medical school, dental school, nursing school, pharmacy school, and we also run a chain of pathology labs. And I have played a humble role in developing this region into medical tourism destination. For the last 10 years, we have been promoting this region as medical tourism, and people are coming forward from more than 15 countries to Ras Al Khaimah for advanced tertiary care. So people are coming to this region. I would like to highlight it more because people think that this place only sends patients out. But this place has also been able to reverse the trend. Today, we are getting patients in UAE coming for heart surgery, brain surgery, spine surgery, good joint replacement program, and meaningful programs. So I have played a small, humble role in that initiative. Thank you, Dr. Tariq, for this opportunity. Over to you.
Thank you very much for the description. And now from Australia and New Zealand, we have Mr. Sam Amroy. He's the General Manager of MENA region of Orient Health, which is a New Zealand-based. To you, Mr. Sam.
Thank you. I guess just a very brief introduction. So my name is Sam Amroy. I am General Manager for Orion Health. I run a very large territory, approximately 73 countries. I have in my career been running healthcare for Microsoft, for General Electric, and now at Orion. So I've had a 10-year of working aggressively in healthcare IT. A little bit about Orion Health. Maybe you have heard or you haven't heard about them. Orion Health is the biggest healthcare company in New Zealand. It's also the biggest IT company in New Zealand. We're both together. So we're healthcare IT. We have approximately around 750 plus staff. We are in over 30 countries right now. We have about 25 offices. So we're kind of like the big company that no one's ever heard of. But we are very humble, and we have probably over 400 to 500 customers today. And we have approximately 10% of all the world's healthcare data running through our system. So we're very proud to be able to say that. A little bit about the company itself. We are in the business of healthcare information. We help large governments, small hospitals work together. We are in the business of integrating data and information. We have been very, very heavily publicized over the last few months in the way we have worked around managing COVID and helping different governments manage COVID. So I'm looking forward to tell you a little bit about that throughout our conversation today. That's all from me. I hope that gives you a little bit of introduction. Thank you.
Okay, no, thank you very much, Mr. Sam. We're still waiting for from China. So once he joined, then we'll just follow this same procedure. But until then, I have a few questions for each panelist. So you can be our panelist. I would say you can be as detailed answer as possible. To you take your time, that to explain the questions right and to have our participant understand. Remember, these participants from US to China. So we have hundreds of participants from different countries. So our message has to go, and they have to understand each and everything what we're trying to say in this webinar, and getting this world to know that what we are going through is something that is not in one region or one country. Is all over the world is facing the issue. And I think the only way we all can pass this tough time is that we unite ourselves, we pool our expertise, we pool our minds and heads, to achieve something that could be as a solution of the current crisis, which we never expected in such a quick time, in at least that what I know in life. I will ask my first question to Mr. Randy Ostra, who is the president of ProMedica, based in USA. My question is that in what areas has ProMedica seen innovation given the COVID epidemic? You can kindly please answer this question.
Right. So, interesting times, clearly. We're kind of on both sides of the fence in some ways. We're still taking care of COVID patients. Where we live in Ohio, our numbers have gone down quite dramatically. Our hospitals at its peak, we're seeing about 150 to 160 patients a day. Today, we're probably more in the 30s to 40s. So that's the positive news. We do run senior facilities across the country, so we have some hot spots there. And I think a couple things that probably stand out relative to innovation. Of course, we've all seen this huge increase in telemedicine and virtual healthcare. Before COVID, we would probably do 60 televisits a day. And literally in a month, we were doing almost 900 a day. So most of our office visits, most of our physician visits were done remotely. And so I think when we look at that, I think that's probably the biggest change that we've seen, which a lot of people across the world have seen. I do think we're going to see a lot of innovation in supply chain in the United States. The words thrown around is instead of just in time, it's going to be just in case, where we're going to keep more supplies available through stockpiles and things like that. A lot more focus on the social determinants of health. I think one of the interesting things about COVID that people were surprised about is what populations were impacted the most. So a lot of emphasis on looking at the social determinants of health and addressing those in very, very innovative sort of ways. I think, again, the U.S. has learned a lot about some of the innovation needed in public health, a lot more focus coming out of senior care. And then I think we've all figured out a lot more ways to work from work. So we totally have about 55,000 employees. In our kind of system offices, we have about 4,000. And since most people are working from home, probably about 500 or 600 won't return to the traditional workplace, but work from home. So we've learned a lot in a lot of these sort of things. I think this whole telemedicine piece and healthcare at home piece are really probably the two areas where we've seen the most innovation. And standing up hospital at home type services is really the area where we think that our future is going to be different than anything else.
I see. All right. Okay. No, thank you very much. I understand. Can I request the panelists, if you are not using the audio, if you can mute who's not using the headphone? I think we have an echo. So either Mr. Sam or Ms. Dr. Raza. If you're not speaking, kindly mute the audio. I appreciate it. Yeah, no, I think the US is going through a very different time. And I think in what is happening in US, what we hear in the media and listen, I think too much happened in last 30 or 60 days, and I think, but I'm sure that things are getting better, and I'm sure ProMedic are doing a great job of putting things together, and Ohio is a lovely state. And I think every state is going through different ways of coping this issue. And even I understand things are opening up, but I think that's a different subject. Is the right time to open or not open. But I think if we do take care of ourselves, it doesn't matter which part of the world, we can, bypass this time. But I know healthcare in US is a total, complete new test. Being living in US for a long time, also that I understand, I can really understand that what Mr. Randy, you're doing in the US. In this current situation. Now I'd like to ask a question with Mr. Harry from Hewlett Packard Enterprises. That my first question to you, that how is the ICT industry, for example, like HPE, helping to fight this COVID-19 crisis?
Yeah, I think it's a very good question. And I think there are a number of examples how ICT industry is helping to fight COVID-19. I think that one of the important initiatives that started by companies like HPE, but also Microsoft and Google, is a so-called Open COVID Pledge. And what that means is that this initiative, we grant free access to all of our patent technologies. Well, that's unique when you look at the past, for the purpose of diagnosing, preventing, containing, and treating COVID-19. And with this initiative, organizations are now free to use our technologies from the technology partners, the ICT companies, without worrying about those patents. And that was before COVID. It was, well, not real. They are free to use and combine our technologies with their own technologies to create breakthrough solutions to combat COVID-19. Well, I think that's a very good example. And in this example, I think at these times, it's more important to cooperate than compete. I think that's one very important part. Another example is that researchers around the world are using our supercomputing and artificial intelligence to diagnose treatment of COVID-19. And we do that as a member of what we call the COVID-19 High Performance Computing Consortium. That's not only HPE, but it's a consortium of more big ICT companies. And what we also saw is that it was at the beginning of the outbreak, is that we saw that pop-up clinics and hospitals were quickly established. That was throughout the world, I believe. And what we see, for example, is that in Genoa, there was a ship transformed to a floating hospital. And what we've done there is that the Wi-Fi technology and location-based services, we fulfilled it over there. And why? Well, these technologies can give doctors online access patients to medical records and help them also locate essential instruments. Those are just a few examples of how ICT companies like HPE are responding to COVID-19. And there are a lot of these. And it's not only HPE, of course, it's more than only us. And I think what I said in the beginning, in times like these, I think that cooperation is more important than competition. And that's, well, pretty unique in this part of the history.
No, I think you're right. I think we need more movable hospitals now. And I understand there are some hospitals are made in a bus, or they are large, like a van or something. They're converting into the testing and multiple ways using it. And I think HPE definitely could play a technology-wise, incorporating maximum things into the space that we have in the movable hospital. But I think even in hospitals, definitely what HP technology and what I also understand, the HP also have contributed millions of dollars into this COVID crisis, from their head office, and
sure.
I think, yeah, I think that's highly appreciated that every corporate, every level from, is coming forward to contribute whatever the best they can do during this time. Now we move to from we were in US, we went to Europe. Now let's come to this Middle East and Africa region where Dr. Raza Siddiqui, who's the group CEO of the Arabian Healthcare Group, I have a question for you that what are the challenges that being faced by healthcare providers due to this crisis or pandemic, that how do you think the healthcare system providers are?
Thank you very much, Dr. Tariq, for this interesting question. And we from the healthcare fraternity all over the world are facing the most challenging time of our life. And nobody could expect such a situation to ever exist. So this is a lifetime situation and experience for all of us. I will address your question in two parts. One is operational challenges, what we are facing, and second is the economic challenge which healthcare providers are facing. In terms of operations, hospitals typically are outpatients, inpatients, and elective surgeries. What has happened is suddenly this situation has come and nobody was prepared to handle this kind of situation. And this organism is such that this is totally unseen enemy we are fighting with. Now, what has happened is internationally, the governments have decided to stop outpatient visits, inpatient elective surgeries, and hospitals are basically designed for this kind of work. What has happened is these highly infected, infectious patients have started to come to hospital in search of life-saving solutions. Now, the serious situation is that most of the specialist doctors like cardiologists, neurologists, neurosurgeons, orthopedic surgeons have suddenly become defunct because all the elective work has been stopped. The outpatient services have been cut down to almost 30% now. If in our hospital we were seeing 1,000 patients in a day in outpatient, today it has dropped to only 250 to 300 patients. So the challenge is here, operational challenge is that staff's morale is the key. Imagine a nurse putting her hand and taking a swab from an infected patient, exposing herself, not only herself, but the entire family. The caregivers going to the infected wards, infected patients, and providing them top of the line care. Now this situation is, in spite of providing the best PPE, people are still falling prey to these dangerous organisms. And once you see your fellow doctors, your fellow nurses, your fellow healthcare providers falling day in and day out, the challenge for us as CEOs and the management is to keep the morale of the frontline people high and keep them motivated to continue to provide the care to these people. These are the serious operational challenges which only people who are facing this can only experience and explain. The another issue is, very serious issue is economic issue, because the main revenue used to be 70% from outpatient clinics, which is totally cut down, which is 30%. The main revenue for the hospital used to be, they are designed for profit hospitals in elective surgeries. Your all joint replacements, your heart surgeries, your other things have been totally stopped. So you have manpower, you have highly skilled manpower, which is sitting at home, which can't do anything. And you have another section of manpower, which is exposed. Now, in terms of economy, I have to continue to pay the same salaries to people because you have to retain them. And we are dealing with mostly expatriate workforce. So they have families, they have houses, they have children going to school, so you cannot cut their salaries. Second big challenge is supply chain, because the expense on infection control, the expense on PPEs has gone up like anything. What has happened is world has seen a different world now. We have seen, my colleague from China is not there, so I can take the liberty of speaking that entire manufacturing, entire supply chain was coming only from one part of the world. And once that world is closed, you practically are dried up of all your supplies. People realized in these difficult times that all the PPEs, all the consumables, all the disposables, all the base pharmaceuticals were coming from China. So the mask which I was buying for 50 fills, we are paying 2 dirhams for that. So it has gone 4 times. The PPE which we were getting for 25 units, we are getting for 100 units. So this is a big lesson which the world has learned. And second thing is a big economic challenge for the healthcare providers, because your cost has gone up like anything and your revenues have dropped down. So these are the two key challenges which all of us are facing, and trying our best to continue to provide the best possible life-saving treatment to all the people who are concerned. The challenge is we have around 500 to 1,000 patients coming into hospital for COVID screening. The staff which is collecting swabs, the lab technicians which are doing the analysis, they are all the time exposed. Whatever precautions you take, they have serious exposure there. So these are some of the key challenges which we are facing, and I'm sure we will find many ways to come out of it.
I see. I think very you focused on very three different areas, that how this the healthcare or hospital operators are going through at this stage, and I think especially where you are in UAE, where there are more than 200 nationalities live, so it's very hard to see the immune system and how they cope and how they manage and how the families, the work and the culture. And I think we have there is a good environment in UAE, but still the immune system works differently. So I think that we can understand the challenges that you might be facing when somebody is coming to your hospital there. And I think definitely economy is definitely is affecting all over the world. And I think the hospitals are one of those industries that at this time especially, that if you're not profitable, you can't shut down either. Have to keep going, because this is a social service. This is something that you cannot do thing at this stage. So I do understand the healthcare providers, the issues they are facing it, but I think they are not thinking that. They're thinking to help the community and help this current situation in their own areas to make it safe. Thank you, Dr. Raza. Now I want to move from there to New Zealand, Mr. Sam, who is the general manager of Orient Health. I'd like to ask you a question. How do you see the role of healthcare, IT, in the response to the COVID-19?
Sure. Yes. It's a good question. Can you hear me clearly? Everything can hear me okay?
Yes, we can hear you.
Yeah, look, the potential of healthcare IT to help with the management of things like COVID-19 and improve systems demand is really significant. There are opportunities around existing health information exchanges, if you like, or we call them HIEs during this types of crisis. If you haven't heard of HIEs, HIEs are sort of health information exchange hubs. And basically what they do is they create a conglomerate of information. So they take all the different systems across the region, across a country, across a space, pharmacies, whether it's laboratory, irrespective of what the information is from healthcare, and they put it in one holistic view. That basically empowers you as a Ministry of Health or as a physician to get a much better view of all your patients across the world. So Orion Health is one of the leaders in that. I think we have over 55 HIEs around the world. I think that's the most right now. So on that hand, really, we've seen an effort to build on what we've already done in an existing sort of HIE space. So many have been expanding their HIEs to new users, new care professionals, or new emergency services that have suddenly popped up, or community pharmacies, or even care users in the home. So new features have been added to such, to tailor for COVID-19 hospital admissions, and new forms created, and things like risk scores, or new tools that are there to allow staff to collaborate in a paperless environment, right? You don't want to have papers being exchanged that potentially have COVID on them, right? So we have to be careful. And last but not least, sort of new data feeds have been found because you're having new temporary hospitals pop up, or repurposed buildings that used to be a school that now is being used to care for patients. And sort of last but not least, some HIEs have been looking at sort of new technology platforms to manage the outbreaks. With that in mind, Orion launched an outbreak management solution just a few months ago, and this brings together proven technology that helps identify, helps manage, helps engage with the population. And it's really sort of designed to help alleviate some of the demand that's happening right now, that incorporates things like remote patient monitoring to track the patients whilst they're at home, or patient portals where you can communicate with your physician from your home, where you can look at your results, you can add testimonials about where you are, what you're doing, your temperature, things like that. And last but not least, all of this is sort of being encompassed in a single holistic view with analytics, because that you need to be able to look at the entire population to be able to make a better decision as a ministry or as a government. And that technology is being used today. We have customers that are using it in Canada. We have customers in France. We have customers on islands that are using it. So, healthcare IT has become the go-to solution to help to discover what they could do. And that's really what's going on today in the market. I hope that gives you a bit of an indication.
Right. Yeah. No. Thank you very much. I understand New Zealand is one of those places have controlled very quickly, and they managed, and they have a very few cases. That's what I hear.
So actually, just before this webinar, I was on another webinar with the New Zealand government, and we were just discussing. They have only 1,350 cases in the entire country, with only 21 deaths. So it's a it's a very, very impressive management. And I'll talk more about that later if anybody would like to know more.
Yeah. Okay. And I don't know how true that is. I see the countries where there are women leaders, like New Zealand, Germany, Norway, they have very less rate of COVID. I don't know what's the theory behind that, but thank you very much that New Zealand had control for their citizens and residents there. That's good to know. Yeah. Okay. Now, I think I apologize for the Chinese participant. The panelist, still is trying to get in. You have some technical issues or whatever issues, but we'll keep on going. If he joins us, is okay. But I think we are moving forward. I want to go back to Mr. Randy now, and ask him a question that what do you believe will be the biggest changes of ProMedica in the US healthcare system because of this pandemic?
Yeah, there's a couple things there, and I think we've talked a lot. I think this whole idea about being able to do video visits, telemedicine, I think, the technologies existed for some time, but the COVID event, as we've been talking about, really made people access, their physicians and their caretakers in very, very different ways. And I think the biggest change has been for our physicians. to a physician the other day. He mentioned that, you know, the way he grew up, the way he was trained was to see every single patient in the office. And now that he was forced to do that online, he found it to be much more productive. There is an appropriate way to, you know, see patients, and that they don't always have to come to the office. And he saw it not only as a way to do better care, more convenient care, he also thought it was a way to increase his productivity and access a lot more patients. So, you know, we worry a lot about, you know, physician availability and workforce shortages. And so I think that's one of the major things that's come out of all this. The other part we haven't talked about is just some of the mental health aspects of what we've seen out of COVID, both from our employees, but also from our caretakers. And again, you know, we all know the stories of, you know, loved ones not being able to see their, you know, their family members in their last minutes of their life, and caretakers shouldering that burden, and, you know, a lot relative to burnout, PTSD, and those outcomes as well. And so I think, you know, not only have we changed, I think, medicine in a lot of different ways, we've also changed, I think, how we look at caregivers and the attention that we need to give to caregivers than our staff. And then I think the other thing is just, we've known for a long time, and some people believe 30 to 40% of healthcare can be done in the home because the technology exists, and we've all seen it. We have a home monitoring center we're setting up that's staffed by caregivers. And clearly, you know, given COVID, we wish we would have had it set up sooner. But this idea of taking care of a lot more patients at home, where people want to be anyway, and oh, by the way, we can do it more cost effective. I think all those areas, because of what's happened, really has given a lot of impetus to those. And I think we've, especially in the States, have seen a lot of lack of attention to senior care. And I think we're going to see a lot of things come out of that. And then just this, as we think about how COVID impacted people, you know, people that have that live on the edges and that have a lot of social issues in their lives. Again, in the States, we know the term social determinants of health has been around for a long time. People have gotten a lot more religion about it, and hopefully we'll do some things about it. So, you know, I think a lot of these things, Tariq, were kind of out of the box, and we won't be able to put them back in, and that's in a kind of a good thing for people in healthcare. And it'll just be interesting to see all the technology, the advances that have come through COVID, if they actually stay or we go back to our old ways. But truly, we're going to be very different, think about things different. Even as we think about personal care, personal safety, cleanliness, you know, use of everything from hand sanitizers. I think this will be one of these pivotal things in life where people will change in very kind of basic practical ways, but also have changed not only how we do business, but also how we deliver healthcare.
Yes, yeah, I think you're rightly said. You know, I think what you said, the home care, you know, I think this is a great idea that you are doing it. I think the home is the best and safest place right now. And I think if they can have their care at their good, clean environment of their home, I think that's the best service that I think the ProMedica plans are. I think that's a great plan of service that they're offering. I think the U.S. is, you know, the numbers are going high, you know, but I think is a big country, so I'm sure there's new ways and having provide the healthcare service to their home environment. I think this is one of the key solutions of the big country and everything. Yeah, thank you, Mr. Randy. I want to move now to Europe and to Mr. Harry from HPE. My question to you that. Did you see any changes in healthcare ICT due to COVID-19 outbreak? And do you think that these changes will be persistent?
Yeah, very good question. I think there are a number of things, and some things are already mentioned, like working from home, etc. I will go into that a little bit further on. But what I've seen, one of the sensitive discussions we had here, at least in Europe, and also here locally in the Netherlands, in the last decade, so that's a very long time, was sharing personal data between healthcare organizations. And Sam already mentioned a little bit about that, to have a more holistic view on all the data that's somewhere. Well, what I've noticed is that from the start of the outbreak of COVID-19, that it was very clear that a need to exchange all personal data to have a good overview was a must. This could be isolated in one hospital or in one institute, but needed a broader view on country or international level. And that's what we see right now, of course. And what we noticed that all discussions we had during the last decade, they disappeared all in a sudden for the sake of our health. And that was a change, and that's only 2 months ago. That changed radically. And what we see now is that with loads of data and intelligent software, we have almost real time an update on the COVID-19 situation. And we see it daily, on a daily basis, and if we want to have it on an hourly basis, on city, country, continent, and worldwide level. And to my opinion, it's a very positive movement and development. And that's one thing that's changing due to COVID. So I don't think that we will lose that, but we will have to manage that after COVID, how we handle that. What I just mentioned, working from home, I think 2 months ago, we all started working from home massively. And that was, I think, in the beginning, it was for many people a little bit different. And most of all, I think also the social aspect, and not only the technology part, but the social aspect, as also mentioned by Ryan. But after 2 months, I think that many of us see many advantages of working at home. We see less travel time, no traffic jams, less CO2, more time spent with your family, and above that all, keeping productivity on the same level. Because that's one of the, I think, very positive things. And the strangest thing is that all that technology was also available already years ago. It was no problem. But I think that in the past, was one thing that kept us away from working from home, that was trust. I do believe that in the past, before, let's say pre-COVID, that managers would like to manage on availability and not on, call it output. So I think that when we see now that it works, because I do believe when I look around, it really works, both for healthcare and also for outside healthcare. Employers need to get used to this new situation. So we have to adapt it, I think, this working way. But also therefore, I think that many companies will have to check their resources if they're equipped to do the work at home. And on the other hand, working from home, there's also a threat, because hackers find the way to home workers, home offices. I think that home offices are an easy target. So we have to be aware of that threat of hackers to get information from the company from home offices. So I'll prepare for that and check your resources, etc. if you've not done that before. But it's pretty new for some people. So another thing that I've seen, and you also saw it, is that all big events, big live events were cancelled. And instead of that, what we see right now is it goes all digital. Well, I think this is a great example of a digital event. We have here a worldwide event with people from all over the world. And we see it also from an HPE perspective. We have our yearly event. It's called HPE Discover in Las Vegas, a very good event for 3 days. Well, we changed it now to a digital event. It's not 3 days, but 3 months. So, and everyone around the world can attend, and no one has to travel to Las Vegas in the planes, etc., etc. So I think there's a really big advantage. Nevertheless, Las Vegas is a nice place, but stay at home to watch all the great things. That's also very good. So those things, I think they will stay, and we will see all the big advantages also for the big events. So I think there will be a combination for the events, a little bit live and also digital. So that's, I think, in short, that, and there are a lot of other things going on, of course, but in short, I think these are things that will be persistent.
Right. I think you rightly said, I think what we all working from home and doing virtual meetings and all this, I think it was coming. We were not expecting to come in 2020. We were expecting after 3-4 years that things will happen. So in a way that we move forward and we bypass few years to get this, incorporate this technology into our businesses, into our personal life and everything. And most of all that I've feel that because I represent United Nations also, a representative here. So most of all, by staying home, keeping working and everything, other than what you said, Harry, is the environment.
Yep,
We have much clean environment to breathe outside now.
absolutely.
And that
Yeah,
will also keep us, everybody will keep us longer life by breathing a clean air for us, So definitely have some positive points and definitely have negative also, but I think more positive angle that we are looking into that. It's a good sign from all the nation of the world that we are moving into right direction and
yeah.
everything. Thank you. Now I want to move from there to the Middle East area, Dr. Raza, based in UAE. I'd like to ask him a question. What is your outlook after this pandemic? What do you see?
Thank you very much. I think this is the best question, and I'm lucky that I'm getting an opportunity to answer. The world is going to change pre-COVID and post-COVID, and so is going to be healthcare. We have to move away from fixed business designs and models. And in healthcare also, we have to move away from typical stereotype hospitals. And I will address from both operational and economic point of view. Like, for example, telemedicine is going to play a major role because up to now, I've seen telemedicine for the last 25 years, from the origin of telemedicine till date. And most of the times, telemedicine was used only as a marketing tool. People did not see the real utility of telemedicine before COVID. I will link it to the economic scenario. In this part of the world, 60 to 70% of the revenue used to be from outpatient visits. Imagine if we preempted and we prepared ourselves with alternative of telemedicine. All these customers, all these patients who are scared to come to hospital, who are scared to leave their homes, could have been benefited with structured teleconsultations. We could have very well designed payment gateways. We could have very well dealt with insurance companies for the reimbursements. So entire consultation could be provided in the comfort of your home with all the best possible doctors available providing you care. So I think the most important thing which is going to happen is the use of technology and telemedicine. And number two, Randy has already discussed home care, home ICUs. This is going to take up in a big time. And I think with the help of technology, the entire care could be monitored and provided in the comfort of the home. Third thing is, which we realize now, that people requiring genuinely investigations like X-ray, ultrasound, lab investigations are scared to go to hospital. So we have to have a model change altogether. We have to have more of standalone diagnostic centers which are not typical hospital environments, which are more clean, friendly environments where people in such circumstances or normal circumstances could go and do the investigation. Third thing which we have seen is the serious problem our cancer patients are facing, because they cannot afford to go to a hospital under the circumstances, because God forbid if they get infected, they are gone. So we have to have more focus on specialty care. We have to have cancer hospitals separately. We have to have orthopedic centers separately. We have to have single specialty eye care units. We have to have more of mother and child centers. Imagine if somebody has to deliver. I mean, we have seen in our hospitals live, a woman is COVID negative, child is COVID positive. I mean, so many things, so many challenges you have seen and you are learning from them. So we have to have hospitals which are dedicated mother and child hospital, so that people could go in a clean environment away from such infectious diseases and deliver in clean environments. So this is something which we have learned. So this is not only operationally addressing the issue, but also commercially keeping the healthcare system alive, because all these subspecialists, super specialists could continue to work if they had environments like this where they could go, and in environments which are away from infected COVID patients, they could continue to provide elective care to patients. Now, it doesn't mean that the people are not sick. People are sick, but they are not coming out. So this is going to further complicate the situation. Another thing which we have learned and which we keep learning hard way is the one thing which I always propagate. Wellness is this key solution. Today, everybody is talking about your immune system, and which has to be the focus in future, because nobody can take care of you unless you take care of yourself. Now, God has given us solution for all the sicknesses, for all the problems inside our body in the form of immune system. So we have to live a healthy life. We have to regularly exercise. We have to have right kind of food. We have to find ways to sleep for 8 hours. So that's the key message. Today, the only solution, because for this disease, I don't think anybody has come out with a solution or right prescription. We have been trying, disease is new, but everybody is saying you can manage it if your immune system is strong. And believe me, this is not going to spare anybody. All of us, in some form or the other, are going to be exposed to this problem. People who will come out as winners are the people who have strong immunity, who have a strong immune system, and who have a healthy lifestyle. So these are some of the key take-homes from this situation. That's why I say pre-COVID and post-COVID. Provided things, we do not forget about it. Chances are that after 1 year, this will be a story to tell our children and other people that there was a situation like this. So, but I think this is a great message and great learning for all of us. And post-COVID, I see these suggestions to be implemented in healthcare, and I think all of us are going to benefit from that.
Well, at least thank you, Dr. Radha. At least you said that once this is over, it's not coming back, right?
You don't know.
No, I hope not. I hope not. And I think what you rightly mentioned, I think that we have to invest in ourselves by eating good and exercising and get your immune system into the better shape. And that's the best investment you can do yourself. And nobody can do it, it's ourselves. So I think if each one will take that responsibility and be prepared for that, and we can fight this or any other situation we may face in the future, we can fight on those health issues. Thank you very much, Dr. Raza. I want to move now to New Zealand, Mr. Sam, and I'd like to ask a question. What is the role of machine learning and AI in assisting the global response to COVID-19?
Yeah, sure. So I think, AI and machine learning is artificial intelligence, everyone is talking about it. And it's going to be an important factor moving forward, I think, to try and identify the new diseases in the world. But our knowledge of COVID-19 is very much still spread across the world, and its impact is growing daily. Research teams from around the world are working on models to help to better understand, who's at risk of the virus, and how to diagnose patients, how to develop better drugs develop drugs faster, and find existing drugs that might actually be able to help today, or even predict the spread of the disease, and be better prepared for any future pandemics, right? That's the role that we're trying to play. The potential of work changes the course of the pandemic hugely. So this is an important factor, and to effectively harness the power of machine learning and AI, organizations are looking for stable, automated, scalable access to algorithms, to models, things that they can output, whilst at the same time, freeing up the researchers to expand on existing models and to develop new ones. So there's a lot going on. Excitingly, Orion Health, we recently announced that we will deliver a national algorithm management solution for New Zealand. This is a huge thing, and it will be provide infrastructure, tooling, resource, necessary support for optimizing models, timely distribution of the information to the New Zealand government and to the healthcare professionals, to the providers themselves. So, being able to give people information and data is a massive feat, which is not simple. But as new algorithms are developed in New Zealand and internationally, this will enable appropriate governance and fast deployment of the latest findings and the research and the practice. All of this will teach us to develop better around the world. Multiple parties will be able to submit algorithms to the platform. Multiple parties will be able to utilize that platform to make better judgments and better decisions moving forward. We're pleased to be part of that important national program with the potential to improve how we combat current pandemic and any future pandemic, and ultimately save lives, right? That's what we're all trying to do. And we've been a very big part of that in New Zealand. One of the reasons that the numbers are so low in New Zealand is because they've very quickly turned on IT and very quickly started looking at numbers, very quickly managed to lock down the country. Yes, I know we're very far away from everyone, and New Zealand is a small island, and it's easier to lock down than a big state. But the reality is, the IT and smart machine learning AI was a huge piece of that. And I think it will become even bigger as time moves forward, not just in New Zealand, but across the world.
I see. Okay, thank you very much. Definitely technology and all these things, definitely would be, this is what we are looking forward. And I think I see it coming already that in the passport, the last few pages would be the health passport of each country passport, which shows your health history. I think that probably is coming very soon. So this way, when we to have a safe travel to different parts of the world after this is over. And definitely there's a lot of new ways and new things I think will be coming and which is better for all of us. At this stage, what I want to do a very quick poll from our participant. So each participant, if you can be ready, I will ask a question. So there will be 4 different options. And I'd like you to vote on it. And then we want to see that our participants feel like who are from all over the world regarding the question. And the question is, how long do you think the economy can recover after the COVID-19 pandemic? The options you will have is 1 to 3 months. Second option, 3 to 6 months. Fourth option, 6 months to 12 months. So I like to give to participant just like a half a minute. So please kindly vote now. Our panelists, we cannot see that poll. Okay, so let the participant, they will only vote at this. I encourage everyone to please vote your opinion and gifting is very interesting, and I think we have a very, I will give another 5 seconds to vote everybody. I think so. Now I think pretty much the results are there. So let me share with the panelists the vote. What I see that almost 0% says that things will get better in 1 to 3 months. There are about 17% of the people say 3 to 6 months that the economy will get better. 21% people, they say that 6 to 12 months, the economy of this world will get better. And most of the people, 60% people, they said that it's going to take over a year. I think that shows that everybody is going through very different time, and they are prepared to take that into at least we all should be prepared, because all the poll result means that what other people are doing. See, we are all confined in our homes, so we are just limited to our access only, but I think it's good to hear these polls what other people are thinking, so we can do as a business owners, as a business operators, as a hospital operators, or whatever industry we belong to. It's good to know that which way, that how the other people are thinking in a different way, and so I think that's very interesting to know what it is. I want to play now a short video that gives a break to the panelists. Then we'll come back after this 2-minute video. We will have some questions from the participants and some closing remarks. So I will play a short video on COVID-19, how people are thinking now.
Are you scared yet? They say this thing, it kills your immune system, attacks your lungs, makes it hard to breathe, and it's spreading like wildfire, causing havoc. Your friends and family are gonna get it, if they don't already have it. It's tragic, I tell you, madness. Scientists say old people get it worse, but most get it eventually. They say this is new, but no. This has been around for centuries. Look at history, it's just a different name, a different strain. And now there's no way to contain it. It affects the rich, poor, young, old, the unknown, the famous. It's dangerous. Everyone's on edge, locked inside of their homes nervously. Borders are closed, countries declare state of emergencies. Grocery stores are empty, nobody's praying in church. The world has gone to crap. No wonder toilet paper sold out first. The stock market crashed, thousands laid off work. Hand sanitizer is going for $1 million a squirt. You better not sneeze, cause no one's gonna say God bless you. They might even arrest you. I don't mean to stress you, but washing your hands obsessively in the restroom will not protect you. Friends, I'm not talking about coronavirus. Now this is a virus even more deadly. The F virus. You've seen it. It spreads every minute like an epidemic. It lives on surfaces, most commonly remote controls, TV screens, cellular phones. It makes you desperate. Doctors say every time you scroll down your feed, you get reinfected. It invades the brain, and when it mutates, it turns into hatred and blame. China did it, no Italy did, no Iran, no Spain. Oh, I didn't make it clear? The F virus, ladies and gentlemen, is fear. But don't be afraid. Despite what you hear or see on your TV, there is good news during this tragedy. To fight loneliness, people are performing concerts on their balconies. The UAE sent aid to Iran. Japan donated supplies to China for free. Written on them was a poem that said, "We are waves from the same sea." Listen to me, like every tragedy, we can let this destroy us, or we can use it to our benefit and repair relationships with our sisters and brothers, wipe away silly grudges, because when it's all said and done, all we ever really had in this world was each other. So yes, let's flatten the curve and expand our hearts. Let's social distance, boost our immune systems, be mindful of where we put our hands, but also where we put our attention. Be alert, not fearful, because the F virus is a pandemic easily transmitted. If you do contract it or exhibit symptoms, we recommend immediately dialing the hotline of a level-headed friend. If you are exposed through your TV, change the dang station. Decontaminate yourself through dance, laughter, and meditation. 2020 has been morbid. From Kobe to COVID, may we use these tragic moments to finally wake up to what's important. Right now, tell someone that you care for them. Yes, right now, tell them that you cherish them. If they are not in the same room, ring them up and tell them you will always be there for them. Because together is how we will rise above. The only vaccine for this F virus and every other virus is love.
Thank you very much. I just wanted to share that video just to see how people feel. It's all about, is like you say, is that it's all about us. How we feel and how we behave is how we can. And now what I want to do, there are a lot of questions we have, but we have a very limited time. So I will try to cover a few questions if possible. I see one question for Mr. Harry that, what they're saying is that what kind of innovation are taking by the European countries there in this current situation?
Sorry, can you repeat that question again? Because I couldn't understand it really.
Question from the participant, one of the participants, they say that what kind of innovations are taking by the European countries?
Yeah, what you see, I think, at the moment is that across nations, what I mentioned earlier, is that we have, well, when you look at European, well, let me a little bit explain what's going on in Europe. Despite the shared institutions in Europe, national health systems, governments and societies still operate in very different ways across the continent. And I think that's a little bit different than, for example, New Zealand or the US. And also in terms of their command of resources, their medical and digital infrastructure and expectations of their citizens. And it's all different per country. So it's pretty difficult to say what's going on in Europe. I think that with COVID-19, we are witnessing wide variations in approaches to, let's say, social distancing and the use of technology to inform operational strategic decision making. So I think we have some steps to go there from a Europe perspective. I think that, of course, nations should have the right to manage public health as they feel it appropriate. Still, if you are to effectively manage this pandemic and also prepare for the next one, we need, I think, standards, agreements, and enough legal and technology alignment for cooperation. So I think we have some steps to make there.
I see. Thank you very much. Now there's another question, and I think maybe I could request Mr. Randy to answer that. The question is that you are also connected in these industries. What are the chances of getting a vaccine and how soon?
Well, again, I think we all hear lots of reports about vaccines and hopefully some attempts to accelerate that. There are reports that, vaccines could be available later yet this year. That's probably fairly optimistic. Others are painting a picture that it's going to take much longer. So, yeah, I think, to have a commercially available vaccine around the world, I think it's more a matter of years than months. I think we will start to see some, folks that will, of course, already we're seeing people that are part of studies that are taking place. So I think it's going to be a while before we see a vaccine. We've struggled in America with testing as well, and with test kits and understanding the testing pieces. So, we'd like to move fast, but I definitely think it's a year plus before we see widespread availability.
All right. Okay. Let's hope that we recover from all this before the vaccine even comes out.
Right.
And now another question I have, and then maybe I can request Mr. Sam to cover this thing. That the question is that which industry is going to be the game changers after this COVID-19, except medical?
That's a very interesting question. If you ask me, and I work in healthcare, I think your biggest industry is still food and beverage. Let's be honest, the people who are going to be able to survive and help the world move forward besides healthcare is the food industry. And if you look at what's happening right now in the food industry, there are huge innovations happening around, even in many countries, around how to grow things from a distance and agro farming and things like that. So I would keep an eye out on that. I think that's going to be an interesting market. Although, as I said, healthcare is going to be AI and machine learning is going to be the focus. I will tell you just funny, as we sit here today, we're talking about AI, and I just mentioned that we've done a lot of work in AI in New Zealand. And literally, as we were talking, I got a message on my phone from the government in the UAE asking us to put together a proof of concept because they're watching this right now. So, talk about network. This is a great way of doing that. So, watch out for AI, watch out for machine learning.
That's true. That's true. I think, there's a lot of industries, that we new ways. Definitely, food industry is something. Vertical farming and all those things are coming up. I think two industries which is mainly hurt that I feel is the aviation industry, the airline industry, and the hospitality, the hotel, and all these things. And I say that I have some solution for that. For airline industry, I think back to get their passengers or their clients back into the airplane and start flying, they have to offer something very unique and very valuable to each seat. And that's the only way they make and attract these passengers back, and then they feel comfortable flying it. So the normal flying of booking and traveling, I think is they have to do much more to that. And the second thing, the hospitality industry with these 4 or 5 star hotels with full services and everything, I think is going to take time. Doesn't matter which part of the world you are, that to fill up those rooms. My solution is them to these hotels. Some of the hotels, they should be converted into business centers. Each room should be converted into the offices, and the full service offices, and maybe some free zones, or different people should take those hotels and convert into that. Will help the industry, and that will help some other business community who want to move from the bigger office to the smaller space with a full service office. So they might be one of the solutions that I personally feel that these two industries may work. There is a one question that I will ask Dr. Raza to please answer that if possible. The question is that has any hospital advised digital wearable devices for doctors for self-monitoring of symptoms and for public for tracking contacts?
I think the wearable devices is the future, and technology is going to run the entire healthcare business. So for both healthcare providers and for patients, it is going to be a new norm, new normal. So I think wearable devices are going to be a key uh, key solution and key tool in keeping us healthy and productive. So that's the future.
I see. I see. Yeah. All right. Okay. I think there is a another question that is that I will leave it to all the panelists who like to answer this question. That what are the challenges that healthcare facilities will face and opportunities? Anybody want to jump in and try to answer this thing?
I think after hospitality industry, it is going to be healthcare industry, which is going to face maximum challenges, because the challenge will be how to survive in these times, because the revenues have dropped like anything, cost has gone up. So I think a lot of support is required for all the healthcare institutions all over the world to survive. So which is going to be a very, very big challenge for everybody. And then they have to work on remodeling the way they deliver healthcare.
There are a few other questions regarding, I think, gut healthcare in the journal, like, that if this continued lockdown is worth prevent COVID, definitely is preventing it, but what about the people who's going day-to-day earnings, that how they can survive and everything else, So I don't know anybody wants to make any comments, but I would say, this is something that the challenges that we all are facing. This is the time, I think, that we all have to show our human part of it. We all have to contribute and be a better human being and come forward and help those needy people. Doesn't matter which country, which part of the city they are in. We all should contribute whatever percentage, whatever is small, medium, or large. To show our feeling and everything. I think this is a very good time for all of us to think ourselves and think about the immediate family member, think about the how to be running the operation or business and how we will run the operation and multiple ways. So anybody wants to make any other comment on this question?
Yeah, just I think you said it well, but the hard part here is, especially working in healthcare, we're taking care of patients. Again, we've talked about it. Many healthcare organizations are at a crisis point financially. So you want to be compassionate, you want to be caring. On the other hand, you know, we need to get people back to work. We need to get, you know, do that in a safe manner. So it's a really difficult decision for all employers trying to bring people back in safe ways, to get people back, you know, in the economy and earning money to take care of themselves. So don't have an answer. It's just, I think we're all struggling with the right pace and the right way to do it. But I think we all know that we can't just continue this way either. So it's a really good question. I don't think anybody's got the perfect answer.
I see. Thank you very much. There are a lot of questions, so I'm just picking few. You know, we have a limited time. We have only 5 minutes left to close this session. There's a one question that maybe I can ask Mr. Harry, if you can answer that. The question is that, can I ask the panel from all of us, from an investor point of view, what would be your top 3 opportunities for the next year?
Well, from an investor point of view, I would say telemedicine and e-health, and already Sam mentioned it already, I think, and also the other people here in the call. But I think telemedicine and telehealth, those are really hot issues at the moment. Until I think the outbreak, there was some e-health and some telemedicine. It was a hot topic here in Europe, but e-health is now really the new norm. So I would say invest in telehealth, telemedicine. And also, of course, mentioned before, but let's call it big data, artificial intelligence, but the combination of lots of data, doing smart things with that data, that's also a really hot topic. So 3 points.
Well? Okay, good. Thank you. There's another question that maybe if Mr. Sam can answer this. That how about the education sector? How can we face this? What are the new norms can be as a teacher or in the education sector?
Yeah, look, I have quite a lot of staff working for me, and most of them have grown-up kids who are at the moment going through exams. And all of them are going through exams online. And it seems like this is going to become the norm. Most education is now online. You can go online and take an MBA course, or you can study whatever you like. So I think you're going to see a lot of movement towards online studies and a lot of applications similar to the one we're using today for online education. So I think that's the direction that's going to happen. And you know, there is only so much we can do, but if this carries on the way it is, it's going to have to be the norm.
That's right. You know, I think we have to keep the education of our children and everybody, even ourselves. You know, we always are learning, always. Now, there's a one question that I would request Dr. Raza, and then we will take the one last questions. So, Dr. Raza, the question is that, what do you think the future is holding for medical travel companies after the COVID-19?
Is a $1 billion question, because you know what has happened. I have been part of medical tourism for more than 20 years, and this recently had reached almost $100 billion industry. Millions of patients were traveling overseas in search of quality treatment, and for so many reasons, because the treatment was not available in the country, the treatment was expensive in the country, insurance was not covering. So I think this will take some time for patients to regain the confidence to travel overseas. So you were talking about the business opportunities. I think the local healthcare systems have to become self-sufficient and develop, so that people could get treatment at the place where they are. Everything is not possible. It should be only 1 or 2% treatments for which people should travel abroad. But I think this is a great opportunity and a great lesson for the countries which are not self-sufficient in healthcare to become self-sufficient in healthcare.
I see. Definitely. Thank you. I think we have a lot of questions. You know, I see a very interactive participants from all over the world. There are a lot of questions, but we cannot answer to the participants, you know, but we will, I'm sure you all know that, you know, what we did today. But before I do my closing remarks, you know, I like to have each panelist to give your closing remarks for the audience and the participant and all of us. So can I start with Mr. Randy? Can you give your closing remarks, please?
Sure. I think, I just look at our own organization and what's changed. And, I think it reinforced some of the things we were doing that we talked about today. We're putting more resources in telehealth that we ever have. We've actually dedicated more resources and actually made it its own kind of consumer division. We had done a lot of work in the social determinants of health that has some implications. So we're standing up some centers there. We're doing a lot of work on life purpose because we're finding more and more people are struggling from a mental health perspective. And we didn't get a chance to talk about it today, but we're working with the company to really talk to employees and caregivers about life purpose and making sure they're connected. So I think the kind of bottom line is the things that we knew were important actually came out stronger than ever before. And those are the things from an organizational stand and a personal standpoint that we're all focused on.
Thank you, Mr. Randy. Can I request Mr. Harry for his closing remarks?
Yeah, I will make it a little bit short. And I think, in summary, I think that in times like these, like I mentioned before, is that for this moment, absolutely, I believe that cooperation is more important than competition. And that's, I think, that my belief that we have to keep on with that, even after the pandemic, how long it will take. And another thing is that a great outcome of this pandemic would be that it moves us towards a fairer, wiser, collaborative future for digital health. And those are my closing points for this.
Thank you, Mr. Harry. Can I request Dr. Raza for closing remarks, please?
I think I'm a very big promoter of wellness and prevention. And the solution lies within us, within our body. So all the organizations, all the healthcare providers, all the insurance companies are focusing only on one solution to keep you healthy. So help them by doing this and focus on your body, focus on your immune system. Don't search for solutions outside, solution lies within.
That's true. Yeah, thank you very much. Now I request Mr. Sam, please closing remarks. Yeah.
Thank you. Look, I'm going to keep it very brief. I'm just going to say, just be kind to your neighbor, be kind to your friends, be kind to your employees. This is a difficult time for everyone. Everyone is suffering in many different ways. Just show some kindness when there's a time where it's difficult. That's all you could do right now.
Right. No, thank you very much. As that CEO Club is an international business organization, and we have contributed on this COVID-19 crisis by supplying healthcare supplies like ventilator, masks, PPEs, test kits to multiple countries, including USA, directly from the factories. And we're doing our share to whatever we can do in our capacity in our industry. And we will be doing our share of connecting members to sustain business and be ready for the new way of business environment after all this is over. Through CEO Club Crisis Management Initiative that we have launched last month to help our members, I'd like to thank all the panelists, the healthcare panelists, and the participants, and wherever they are, to be safe and hope that world will come back with much stronger and much peaceful place to live. And you all are healthcare experts, and for all the healthcare frontliners, we as a participants and we as all the community want to have a round of applause by clapping wherever we are to appreciate all the healthcare frontliners right now, on behalf of all this webinar. So just watch for 1 second, please. Thank you. I'd like to thank each and everyone. I'd like to thank from USA, Mr. Randy. I'd like to thank Mr. Harry from Netherlands. I'd like to thank Mr. Sam, from New Zealand. I'd like to thank Dr. Radha from UAE for participating in this wonderful discussion we had today. I'd like to personally appreciate each one of you for their valuable time in being participate of one of a kind of 5-continent webinar. I want to thank the panelists. I want to also thank all the participants who are with us today, and wherever they are, again, I say be safe at home and always be healthy and happy. With this note, I like to end this webinar as one of the series of webinar, but we will have a one poll for the participants that coming up now, and will be followed by a video. So this poll is just about you say yes or no. So the question is that would you like CEO Club to connect you with business opportunity? Would you like CEO Club to connect with business opportunities in the world? So if you say yes or no, your option, please do the poll, and be followed by a home video that we have created CEO Club for the working environment. So I like to every panelist please kindly mute their microphone if they can, and then watch the video. And again, I want to thank all the panelists, and please panelists do not leave the room until the whole thing is over, because otherwise anybody clicks, the whole webinar will end. So I appreciate if you hang on for a few more minutes with us. Thank you again, and please watch the video.
How could you be productive from home while running your business in this outbreak? Keep your usual work routine with timing. Make a dedicated space for the office work. Execute your business promos and new ideas. Keep video communication with coworkers. Continue your connection with the clients over the phone. Collaborate with CEO Club members and brainstorm about new ventures. Together, let's make it happen. A message from CEO Clubs Network in association with SCG Productions.
Thank you very much, and wherever you are, be safe and have a wonderful day. Thank you very much for all my panelists and for the participants. Thank you very much. Thank you. Thank you.
Bye-bye.
Again.